Good evening and Ramadan Kareem to you all. I'm your host, Bara Abdallah, here to bring you a great line of segments featuring local talents, initiatives, and events from around the kingdom as we celebrate the holy month. So stay tuned. We'll be right back. Ladies and gentlemen, now we're talking all dental with Dr. Maha Bayat. All that happening with the future of dentistry right here in Bahrain, maybe even the world. Well, good evening. How are you?
Good evening. How are you? It's really nice to be here.
It's our pleasure. So now with dentistry and all of that, we've been seeing a lot of advancements, but apparently have all that in the know, I would say, of what's happening in the dental world. So what's happening?
There's a lot happening. I
Yeah.
mean, we're in 2022
Right.
and we're way beyond where we were 10 years ago. I've been in this field for almost 10 years.
Wow.
And if I would say that it's really nice that when patients walk in now, they really know how things will be or will look like once they're done with their treatment before even
Right.
starting. Of course, in different aspects, whether it's orthodontics, whether it's cosmetics, whether even it's for like diagnosing a case. So what would you like me to start with?
Well, there's a lot going on. It's what's interesting as well. Before, when it comes to going to the dentist, it's more like of treatment. Now it's became like more into aesthetics.
It is.
Cosmetics, like you said, and apparently, like people, even if they don't have any dental problem, they'll go there just because they want to have, a brighter smile.
Exactly.
It's like, oh, I want to have the smile of Angelina Jolie.
Oh, yes.
I want the same size of tooth, and I'm like, what? There's a size now?
Yes.
I want the grade to be wider than fluorescent light. It's like, what? So I would say let's start with aesthetics because that's always an interesting topic.
Okay. Of course, when you mention aesthetics, that's a wide range.
Okay.
I mean, that's a big topic, and if I would say, I mean, I can just, let's say,
Yeah.
I'll give you a conclusion.
Sure.
Let's say a patient comes and they want to do veneers. Of course, a lot of people use the terminology of Hollywood smile,
Yes.
which I don't like to use.
Okay.
I don't. I mean,
Interesting.
it's a very. If I would use a better terminology, let's go for veneers or aesthetics at least.
Aesthetics. Okay.
So, what happens is, as you said, many patients actually come holding a picture of like any celebrity,
Yeah.
and they would say, "I want to have their smile," but as they say, one size does not fit all.
Yeah.
Each one of us has their own different smile. I mean, what makes you a different person, right? It's not only your height, it's not only your skin tone, it's your teeth as well.
Right.
So when a patient comes in and they decide that they want to go for veneers, we don't personally at our dental center, we don't prefer to go and straight away start with the case because let's say you come in and you're like, "Doctor, I want to do my teeth."
Right.
And I'm like, "Okay, sit on the dental chair, start drilling, take an impression and send." You're gonna be in this agony of, oh my God, how will my teeth look like? Are they
Right.
gonna look good? Or I can't imagine, are they gonna be long or short or wide, and so on. So there's always a very important step that we like to do before actually touching the patient or starting the case.
Okay.
And that's called a mock-up.
Oh, yeah.
So let's say it's like an imagination of how your teeth will actually look like once you start doing the veneers.
Right.
So what we do is, any lab that you deal with, when you take the scan of your teeth or the impression, they would create a 3D smile design for you.
Okay.
Of course, based on the dentist's instructions, pictures, and so on.
Wow.
And we can actually place that on the patient's teeth. They can go home, show their family, show their friends, to be able to see that's how I will look like once I'm done. And I mean, that gives us a better, let's say, result, because at the end of the day, the patient wants realistic results.
Right.
You can't go on and tell the patient, "I'm going to give you the perfect smile," without them knowing how it will actually look like.
Amazing. I mean, speaking of that, right? 3 of my friends, they all have the same smile. It's like, this is weird.
Exactly.
And it's too white.
It's so wide, yeah.
Why do people see that the whiter your teeth is, the more beautiful your smile is? What's the relation?
Actually, that's not the condition now. That
Okay.
was a couple of years ago.
Okay.
If you want to give anything a sense of beauty, it has to look natural. And in order for it to look natural, you need an artist to draw it.
Huh.
So, I
Love
mean,
that.
I can just go in now and take any tile and put it. I mean, that's not my job, but at the end of the day, I can fix it, right?
Right.
But then maybe when a specialist will come, they would pay attention to the details, like they don't want the gaps between the tiles to show and so on. When you deal with a certain laboratory and the ceramist gives you the finest details, patients now, they come to us and they show us pictures and they're like, we don't want white teeth. We want something that looks natural,
Wow.
something that has translucency, and then there's like a better result of a natural smile.
They have a better understanding now.
Yes, they do, definitely.
Wow. So, okay, that was pretty interesting when it comes to aesthetics. Now, that's what I thought I want to talk about. But I'm sure you want to talk about something that is like a leap into advancements. What would you want to talk about in that case?
I would mention something related to orthodontics.
Okay.
I'm a platinum Invisalign provider. Invisalign is the transparent orthodontist that, I mean, where you remove and put your, let's say, the clear aligners, I would say.
Would you explain to us the terminology of orthodontics?
Orthodontics is a procedure that's done to straighten your teeth.
Okay.
It's when, sorry, I use the
No,
medical
it's great,
terminology.
it's great. I mean, because I've been involved in dental conferences, so I came across this terminology, but I think a lot of people wouldn't know that
Exactly.
term.
Orthodontics is a procedure that would straighten your teeth. Like whenever you would have a gap between your teeth or when your teeth are not aligned in the perfect way.
Okay.
So when I would go and talk about clear aligners, I mean, I'm sure you've heard about Invisalign. It's like all over the world now.
Pretty much.
The nice thing is, I'm sure upon, I mean, your dental experience, did they ever take an impression for you? It's like a Play-Doh where they mix it and then they take a print of your teeth.
Put it right there.
Exactly. Yeah. And then many people have something called gag reflex, is when they feel like they're going to throw up because they can't withstand the sensation of the impression material. This is all disappeared now.
Okay.
Because we have something that's called a scanner.
Yeah.
A scanner is like literally, it's a camera. The patient sits, you scan their teeth, you take a picture of your teeth, and that's it, you're good to go. This scanner, when it's related to Invisalign or to the clear aligners, it shows you your smile before and after without starting the case.
That's crazy.
So let's say you come in with crowded teeth. By crowded teeth, I mean like when your teeth are not in place, and then you have a gap between your teeth. I take a scan for you, and I'm like, I just need you to wait for about 3 to 5 minutes. You have an estimation of, let's say, an accuracy of 70 to 80%, or maybe a little bit less, of how your teeth will look like once you are done.
That's pretty good.
So that's amazing, because I mean, a lot of the patients get terrified because it's not easy to do a big treatment without you knowing what's going to happen in future or once you're done. So once they see the result, they feel more like relaxed and then more confident to withgo the treatment.
Wow, that is a big leap. I still remember they brought this Play-Doh and we put it right there, on the upper part of my mouth, and I feel like, okay, now I have a gag reflex. Okay,
exactly.
hold it.
Take a deep breath.
Take a deep breath. That's not working still.
No.
And then it's like, let's do it again. Yeah. It's not easy.
It's not easy.
Now we have a scanner for that.
Exactly. And by the way, that's not only for like orthodontics or like for Invisalign.
Okay.
You can use the scanner even for implants. Implants is when you replace a missing tooth.
Okay.
You can even use it for veneers as well, for any normal crown. So it can be it can replace the entire impression material, or the Play-Doh with our general language.
There's a lot going on now.
A
Things
lot.
are getting faster,
Yes, they are.
safer, and even more accurate and more practical.
And easier for patients.
And easier for patients.
Yes.
What can we expect in the future? I mean, you've been seeing how things are advancing. What do you think we're going to head to right now with all of this?
I mean, if there's one thing that I would, is to replace the needle with something else.
Please.
Because that's the most thing that make people run away, actually.
Yeah, I mean, yes, all of this has to pretty much sleep, and has to stabilize at a certain point, but it's that one part that I had to hold my breath for a few seconds. When the needle gets in, it's like, here it goes.
And I always tell patients, like, sometimes when they're like, why do you have to use it? Excuse me.
Okay.
It's the needle is actually very small. It's just the instrument that's big, and it's because we need accessibility to the area. So just trying to make you feel better about it.
But it's still a needle.
It is.
Penetrating your skin. I mean, now I'm feeling it. I remember that.
Maybe we should change the subject now.
But no, you're absolutely right. I mean, do you think something can actually replace the needle? Is that possible anytime
I mean,
soon?
why not?
Why not?
Maybe. But I hope so, because it would make our life easier as well, especially with kids.
Oh, yeah, poor kids. I mean, the whole purpose of this is to tranquilize the area of the mouth itself so you can actually proceed with the procedure.
Exactly.
And have lower percentage of pain.
Definitely.
So
actually, no pain.
No pain at
No
all.
pain.
That's true. That's
No
true.
pain.
So I don't know, maybe some kind of cream.
Actually, we do use a cream,
Right.
but that's a local thing. I mean, just to give the patient a better, or like let's say it's a gel
Right.
that we put on the area so that you don't feel the needle, or
Okay.
at least you make it. I mean, we make it just a little bit better.
It's the opening act for the main
Exactly.
act.
Exactly.
For the needle.
Definitely.
Okay, so there's a lot to talk about here, definitely. What else has been going on in the dental world that you are pretty much excited and interested in?
Interested in. I mean, I love dentistry. I chose dentistry because I love it.
Yeah.
And I mean, as we go on in the new decades, I'm sure there will be a lot of things. Like, for example, if I would mention or talk about laser.
Yes.
Let's say before, when people used to come with, I'm sure you've seen some people where they naturally come with dark gums. It's
Yes.
like when the gum doesn't look pink, it looks a little bit darker.
Yes.
What they used to do before is, I mean, they would use a blade and all of that. It would be like more of a surgical thing.
Right.
Patients now, they come in, it's a 15-minute procedure. I mean, the post-operative pain is much, much, much more. It's minimal comparing to where we were before. And that's all because of laser. In the coming future, I feel they might start replacing, I mean, you know the drills, right?
Right.
The drill where we used to drill the teeth. A lot of people now, they use the laser to drill the teeth.
Wow.
It's pain-free, it's sound-free, because what we face is that many of the people, they hate the sound of the drill. It just stresses them out or makes them more anxious,
Drills
right?
through their skull.
Definitely.
Yeah.
So, I mean, and there's nothing that we can do about it, because in many of our procedures, we do need to use it. But I feel in the modern or in the upcoming future, we'll be stopping using the drill or the handpiece, and they'll start replacing it with the laser, because the laser actually can be used on the hard tissue, such as our teeth and bone, and on the soft tissue, such as like our gums and lips and tongue and so on. So yes, it does make things a lot easier.
A lot of advancements. We came a really long way here.
We
So
have.
far, so long and so advanced. And where we used to be just, not even 10 years ago, just maybe 5 years ago, and where we are today. If I knew about the scanner, I wouldn't have to go through the Play-Doh and all that. I almost built a castle in the middle of that. I was like, might as well see a castle in the middle of my mouth.
Exactly.
Amazing.
At least you know about it now.
I know about it now. Thank you so much,
Most
Dr.
welcome.
Maha. So now, any advice or tips you'd like to give to our viewers, including myself as well, right now?
If there's one thing that I would give, I don't want to give the regular advice.
Yes.
Visit your dentist twice a year. I mean, we hear that all the time.
Right.
But if there's one thing is, I mean, if you trust a dentist or if you trust your doctor, stick to them.
Okay.
Because what we see is, with all due respect, many patients keep jumping from one doctor to another. And that's fine. At the end of the day, everyone has the right to explore options.
Right.
But there's a lot of conflict to the patient. I mean, when you get a treatment by, let's say, me, or then you get a treatment by someone else, and then you go from, and then even me as a doctor, when I want to know about your history, it's very confusing, because I have to tell you, okay, get me the history from this dentist or from this dentist or this dentist.
It's a lot of work.
Exactly. So it's always easier to, I mean, to trust your dentist, to stick to one dentist, of course, unless anything else happens, or unless this dentist recommends that you go and visit another specialist, or they refer you to someone else. Other than that, it's always nice to try these new methodologies before going for the actual treatment. I mean, if you hear about a doctor or a center, that provides you this kind of a service, that where you can see your smile or you can see your teeth before actually starting with the treatment,
Okay.
I would recommend it because it gives you a realistic, outcome.
That is a very solid advice.
Thank
Trust your doctor. Stick to your doctor. Have a good relationship with your doctor.
Exactly.
That is amazing. Nobody told me this before. We felt like it's okay to change doctor, to go
Of
to
course
another
it's
one.
okay. Of course it's
Yeah.
okay. I mean, I don't want it to sound like
Yeah, I
don't
hear
go
it.
see
No,
someone else. Of
totally,
course, everyone
totally.
has the right to, but I mean, if you know what I mean going and seeing more than one dentist in 1 month
Yeah.
is a
yeah.
bit it's a bit confusing.
It is. No, but that's a solid advice. You know, certain doctors you feel comfortable with and they care about you, not only
Exactly.
as a patient or as a client, but even as a friend as the relationship grows.
Definitely.
That makes a big difference.
Of course.
I mean, there are 2 or 3 in my mind right now. I may stick to them right now and that's it. It makes
Perfect.
life easier.
Definitely it
Well,
does.
Dr. Maha, thank you so
Thank
much
you so much.
for taking us of what's going on through the advancements of dentistry and even to the future. And hopefully one day, no more needles.
Inshallah, no more needles.
Inshallah. Thank you so much.
Thank you
It's been a
so much.
pleasure.
Thank you.
Most definitely. Well, ladies and gentlemen, that was the talk about a modern dentistry happening here in Bahrain and maybe even the world. And regarding the advice, stick to your doctor. All that took place in an interview with Dr. Maha on Bahrain Now. Ladies and gentlemen, this brings us to the end of today's episode. Don't forget to reach out to us on our social media accounts shown below for any inquiries. We love hearing from you. Thank you for watching, and we'll see you in another episode of Bahrain Now. Till next time, Bahrain, good night and God bless.